In this video, I'll talk about male pattern hair loss. This is the most common type of hair loss that affects 50 and upwards percent of males alive and is a progressive chronic type of hair loss that is considered non-scarring. That being said, it is very, very challenging to treat in many of the cases. So we'll delve deeper into that. We've covered female pattern hair loss already. Today is male pattern hair loss time. Before we get started, I'd like to thank each and every one of you for picking up a copy of my book, my best-selling book, Six Skin, Skincare Made Simple, reading it, benefiting from it. Thank you very much. For those of you watching who've not yet picked up a copy, what are you waiting for? Pick up your copy today at Amazon Books at the link below or at the QRS code to my side. Now let's get on with the video. So what is male pattern hair loss? Male pattern hair loss is a very common type of hair loss, as I've mentioned in the opening. It is a chronic progressive type of hair loss affecting 50 and upwards percent of males. And the thing about male pattern hair loss is that it follows a pattern of distribution. Specifically, it starts with bitemporal thinning and a vertex thinning, which is right here at the top of the scalp. You'll see in the diagram. These two converge eventually as the condition progresses, taking out hair on the temporal area, on the frontal scalp, meaning the front right here, extending through the crown and to the vertex, eventually converging all the way to the vertex from the bitemporal area. Male pattern hair loss can actually be very, very troublesome. Male pattern hair loss can affect people's quality of life, can affect their self-confidence. Some people like it and think it's sexy. Some people do not like it. And for those people, there are treatment methods available. If you found this video helpful so far, share, like, and subscribe. Tell me in the comments section, what type of hair loss are you suffering from or a loved one? And how are you treating it so far? How has it affected your life? I'd love to hear more about it. Also, tell me in the comments section what subjects or what topics you'd like me to cover, what burning questions you have. I'd love to take a look at that and get back to you with some more videos. Now let's get on with our video about male pattern hair loss. So male pattern hair loss, chronic progressive condition, affects 50 and upwards percent of the male population, follows a very distinct pattern. Now let's talk about what and how to approach male pattern hair loss. So first of all, do no harm. What do I mean by that? Well, do not take anything blindly to treat male pattern hair loss. If you're not sure if you have male pattern hair loss, if you don't know exactly what are the deficiencies or what are the underlying factors that are affecting your hair loss, do not take matters into your own hands. Do not treat automatically and reflexively with anything that a friend told you, somebody mentioned in passing. Don't go into any of the generic treatments. Those could be detrimental. Now, why do I say detrimental? You use something for reasons you're not sure about, like supplements or even minoxidil. If you're not sure how to use minoxidil, and you're not sure that you have male pattern hair loss, this could backfire, as you could be wasting your time and money on a treatment that may not be a good fit for your type of hair loss, not knowing the time frame, not knowing exactly what to expect, how long you should be on that treatment. You need somebody to have your back. So if you're not sure about what's going on, if you're not sure if it's male pattern hair loss or another type of hair loss, and there could be other types of hair loss that could look a lot like male pattern hair loss, do not take matters into your own hands. Go seek a board-certified dermatologist. Second thing is, don't take supplements for male pattern hair loss unless it's a very, very rare occasion when there's a vitamin deficiency or some sort of a hormonal imbalance involved, which is extremely rare in males. Do not take any supplements. They have virtually zero value for the treatment of male pattern hair loss. Don't waste your time and money. Don't spin your wheels on something that doesn't work. As far as minoxidil is concerned, we'll talk about it in a moment. It is a very common and very effective treatment for male pattern hair loss, but you need to know what your expectations are, you need to know how to use it, and you need to know what the time frame is and what to expect as far as the results of your treatment. Now, there are some types of hair loss that look like male pattern hair loss, but are certainly not male pattern hair loss, and those are very important to distinguish from male pattern hair loss because they respond to very different treatments, if that, and some of them may be scarring. Specifically in the Black community, central centrifugal cicatricial alopecia that I've spoken about before, which is more common in females than in males, That being said, we now have a suspicion among some of the opinion makers in dermatology that this is actually likely underreported in black males, meaning there are many males who walk around with CCCA or central centrifugal cicatricial alopecia who are misdiagnosed as having male pattern hair loss and mistreated. So that needs to be on your radar. You've been losing hair. You need to make sure that you have male pattern hair loss, not CCCA, because the approaches could be completely different. So make sure you know exactly what it is that you're treating. There are other types of conditions like frontal fibrosing alopecia, again more common in females but can certainly affect males and can look a lot like male pattern hair loss. And again, that suspicion needs to be there, that you may not be dealing with something that is male pattern hair loss, something that will require a completely different approach and a much stringent approach as far as the treatment is concerned, with much more aggressive measures and ultimately different medications altogether. So make sure again that you know what it is that you're treating. Make the distinction between male pattern hair loss, CCCA, and frontal fibrosing alopecia. If you've enjoyed this video so far, share, like, and subscribe. Tell me in the comments section, do you have a sneaking suspicion that you may not have male pattern hair loss? Or could you possibly be suffering from another type of hair loss that could be hindering your care? I'd love to hear about it in the comments section. Now, treatments for male pattern hair loss range anywhere from the topical treatment through medical treatment with pills or tablets and procedural treatments. Now, before we start with actual treatments, let's discuss the expectations. What can we expect from effective treatments of male pattern hair loss? Well, unfortunately, the majority of the conservative treatments, meaning the topicals and the pills, those usually get you only halfway there, meaning they stop the thinning, they stop the shedding, that many of them fail to actually gain any traction as far as hair regrowth. So that is not a given with the conservative treatments, meaning, again, topicals or pills. Now, some cases of topical treatments and even pills do get some regrowth. Unfortunately, people who show up late to the game, late to the party, where their male pattern hair loss has progressed and advanced significantly, may not be getting a lot of hair regrowth back, but they may actually get some of the hair back with consistent treatment and with the right approach. So the majority of cases of the conservative treatment do not get hair regrowth. Some cases do, some people do, but it's very important to distinguish between those expectations. So the baseline expectation for any treatment should be stopping or clamping of the hair thickness where it is. Now, the bonus round is to get more hair, more traction with the treatment. So the treatments range anywhere from topical through pills through the procedural treatments. And let's start with the topical. The most common topical treatment is minoxidil topically, either a solution or a foam. It's a 5% concentration preparation, usually applied twice a day to the affected areas. Again, most people on minoxidil do not get hair regrowth so much as they get to stop the hair loss where it is. It's also important to note that any treatment of progressive hair loss like male pattern hair loss will require lifelong or continuous care to maintain the results that you get. Now, beyond minoxidil, there are some topical preparations that have been coming into fashion over the past few years that involve minoxidil and other topical compounds that can work and augment the effects of minoxidil, specifically finasteride, spironolactone. There are preparations that include dutasteride, tretinoin, and even prostaglandins, which are usually used to induce eyelash growth. Those are also incorporated into a lot of those solutions. And those solutions don't have much of a track record at the moment. We need more experience with them. But from what I've been seeing, both in the literature and personally in practice, they do have significant advantages over minoxidil alone. They are far more expensive than minoxidil, so do your due diligence and make sure you pick the right solution for you. Use it consistently. Watch the time frame, which is usually 3 to 4 months, sometimes a little bit less than that, but definitely it's months rather than a couple weeks. And make sure you're getting the right results that you desire for your hair loss. Now, next on the roster are pill treatments. So the most common pill treatment for male pattern hair loss is finasteride. This is a treatment that addresses the androgen pathway, And it works very well as far as stopping the hair loss. In some cases, it gets some traction with hair regrowth. There is one glaring side effect that is not common, but when it happens, it's disastrous, and that's erectile dysfunction. The next medication up on the roster is dutasteride. Dutasteride is a cousin of finasteride. It works very similarly to finasteride, also has the potential to induce erectile dysfunction rarely, and has likely similar effects to finasteride. There are other tablets out there that could help with male pattern hair loss. Specifically, oral minoxidil can be very helpful as well, at the lower doses especially, and beyond that, there are the procedures. Now, there are many different procedures that are purported to help male pattern hair loss. The two major ones are platelet-rich plasma and follicular unit transplantation. Platelet-rich plasma I've spoken about extensively in the female pattern hair loss video. Platelet-rich plasma, or PRP, is a procedure where we draw the patient's own blood. We spin the blood down, separating the red blood corpuscles or red blood cells from the platelets and the plasma. We take the platelets and the plasma concentrate, we spin that down even further to concentrate it further, and then we inject that concentrate into the scalp. This technique works very, very effectively for many types of hair loss. It induces all sorts of changes in the scalp, making a healthier environment for hair follicles to develop and to grow hair. There are many different changes that PRP induces on a microscopic level. It does work very well. It's pricey. It's usually a few thousands of dollars for a package of sessions. You need to get a session once a month for about 3 to 4 months to get significant traction. But most people getting PRP are very impressed with the results. Now, PRP does require maintenance of treatment, so usually we invite patients once a year to the clinic to review their general status and decide whether or not they're due for another treatment. Next on the roster are follicular unit transplantations or transfers, and that involves transferring of individual follicles from the back of the scalp, which is your donor area, to the vertex, front, and bitemporal areas on the scalp, basically transplanting the hair follicles and planting them where the hair is lacking. This technique is extremely effective in the short run, at least, because it induces immediate hair presence in the areas that are treated. The efficacy of the treatment long term is variable, and there's no way to predict who is going to take to the treatment well and who's not going to take well and lose the value that he got from the procedure. So it's pretty difficult to discern who's going to be a good responder, who's going to be a poor responder, and that eventually needs to be followed up and determined on a clinical basis. If you've enjoyed this video, share, like, and subscribe. Tell me in the comments section, what type of procedure have you gotten for your hair loss, and what sort of efficacy have you had with it? Have you had much success with PRP? Has your hair transplantation worked out for you? I'd love to hear about it in the comments section. Tell us about your own experiences in treating your hair loss. Thank you so much for watching this video. More great content coming your way right from this channel. Thanks for watching once again, and God bless.